The 8th case of COVID-19 has been confirmed in British Columbia, involving a woman who recently traveled from Iran. The province says it's preparing for a pandemic.
Something that was seen for a time as a phenomenon linked to China is now a world phenomenon.
The woman, who is in her 60s, is now staying with relatives in the Vancouver coastal health region. Officials say she has a relatively mild case of the virus.
The person is comfortable and self-isolated at home. There are other people in the home who are also isolated who have been in contact. There are a limited number of contacts in this case.
3 additional patients in BC who previously tested positive for COVID-19 are now fully recovered, for a total of 4 fully recovered patients in British Columbia. While the risk of contracting the virus in Canada remains low, the province is preparing for the possibility of a pandemic. But what exactly is that?
A pandemic is where there's an epidemic that crosses multiple regions around the world of a new disease. This has yet to be declared a pandemic because we're still seeing, or still hoping at least, that each of those individual outbreaks around the world outside of China can be contained. If they cannot be, then it's likely it will progress to a pandemic.
If a pandemic is declared, it's unpredictable as to how long it would take to get the virus under control, says Dr. Murty. The last pandemic was in 2019, the H1N1 influenza, which took years to get under control.
Another option is that it becomes widespread and global and becomes what we call endemic, which means it becomes one of our common viruses that floats around in our communities. We don't know which direction it's going to be at this point.
So what changes should we expect if a pandemic is declared?
There's no difference between before it's declared a pandemic and after it's declared a pandemic. So what's important to know is our procedures should be the same, in that we should be aggressively preparing, making our hospitals ready, getting our messaging out to communities.
On Friday, the World Health Organization raised the global risk of spread from high to very high. In Vancouver, Ashley Burr, City News.